If you've ever had a patient experience knee pain when teaching them squat exercises, which I'm sure you have, try these simple techniques to alter biomechanics and reduce pain. Number 1, sit back. By sitting back, you load up the hips and get the powerful gluteus maximus to take the proportion of the load and to reduce the load on the patellofemoral joint. Patients may need to use a wall if they have poor balance. Number 2, take a wider stance. Make sure the knees move in line with the toes, ideally the second toe, and also this stance makes it easier to maintain a neutral spine during the squat action. Number 3, sustained isometrics. These have been shown to reduce knee pain from patellar tendinopathy, and this type of exercise-induced analgesia can be useful for other knee pathologies as well. So try performing it for 30 to 60 seconds before commencing a squat routine.